I think after this, I'm going to go get a manicure.
Welcome, everyone. We're just going to give it a few more minutes to see if anybody joins, and then we will get started.
Okay, well, hello, everyone. Thank you for joining us for our last webinar of this week's webinar series for Texas Falls Prevention Awareness Week. Today, we have some great partners with us that are going to give a presentation on connecting in the community to prevent falls. And we have worked together to make this week come together with a few really special sponsors across Texas, and I was going to name each of those, which is the Center for Population Health and Aging at Texas A&M, the Texas Active for Life Coalition, T4A, Texas Healthy at Home, Texas Health and Human Services, and Unite Us. So each day this week we've had a different webinar, and this week the Unite Us group put on this webinar to conclude the week. You can go to the next slide, Lauren. This year, we were lucky enough to get a proclamation signed by Governor Abbott declaring the Falls Prevention Awareness Week in Texas from September 20th to 24th. The entire proclamation is on our new Falls Prevention website, which is fallspreventiontexas.org. If you want to go check out the entire proclamation there, you can see it along with a nice seal and read it through and share with your partners as well. We're really excited to have that this year. It's been hard to get those in the past. So it's there for you to view. And with that, I think we'll go ahead and get started and introduce our speakers and get on with the presentation.
Well, good morning. It's so good to see you, Ashley and Lauren. So happy to be with you guys here today for our final webinar of Fall Prevention and Awareness Week, where we're going to talk a lot about how we can connect within the community to help prevent falls. So my name is Cindy Quinn. I live here actually in College Station, Texas. I am a manager, community engagement manager for Unite Us. And I have just been really blessed over the last dozen years to be able to work on statewide efforts through the Texas A&M Center for Population Health and Aging, as well as with Texas Healthy at Home as a consultant, and to focus on statewide efforts where we really are thinking more about connecting clinical organizations within those aging service providers to improve health and wellness. Very excited to be working with Unite Us, and later in the presentation, I'll give you a little bit of an intro to Unite Us and what we are doing to really coordinate that community care and social care in order to improve the social determinants of health and health equity. But I want to introduce two of my partners in crime, two cohorts that I have just absolutely loved working with for several years now, and just so excited that they were willing to come and be a part of this presentation with me today. So the first person that I'm going to introduce is Jessica Martone. She is the Education and Training Coordinator for Coming of Age, Health and Human Services of Travis County. And in this role, what she's able to do is support support community-based organizations, nonprofit, partner agencies, as well as the Travis County community by offering up volunteer trainings, evidence-based workshops. She's doing a phenomenal job. I know that she has a vast amount of experience working formally with the Area Agency on Aging as their health prevention wellness coordinator and aging program specialist. So she has taken all of those talents and capabilities and passion to be able to work with the Health and Human Services of Travis County. Super excited to have Jessica here with us. And then, and she is certified in so many master training, so many programs for evidence-based programs. And we'll talk a little bit more about that. The next person that I want to introduce you is another partner in crime. And that is Katherine Tuck, who does hold a Master of Science in Dementia and Aging Studies, as well as a Bachelor of Science from Texas A&M. Whoop! And she is with the United Way Tarrant County Area Agency on Aging. And Katherine, I never say that right, so I am so sorry about that. She is a special grants manager for United Way of Tarrant County. And she just loves to be able to combine her love of psychology with self-management skills by coordinating partners and implementing health and wellness programs to empower individuals and really focus on that healthy aging aspect. She's previously worked with the Community Council of Greater Dallas under the Dallas Area Agency on Aging, and also for the Texas A&M Center for Population Health and Aging. So we are super excited to have two extremely capable people to talk about what it does look like to actually work within the community and focus on fall prevention. So with that being said, before we get to their actual presentations, next slide, I'm just going to focus on a couple of things that I think you might find interesting. I love this picture because that shows us what is happening in Texas, where it's the dark melon color. That's where you're seeing older adults that are actually getting older. And we have 86 counties. And then we have 92 counties that are older, and there's no current change in that. But what we're seeing is that by 2050, we are going to have 8.3 million or 9 million Texans that are older adults. Also, with that comes a lot of different challenges. And one of those would be that 1 out of 3 older Texans fall each year. We actually are on the higher end of falls across the nation. Many states, it's only 1 out of 4, but in Texas, it's 1 out of 3. And that leads to a lot of different challenges. And some of my cohorts are going to be talking about that further in their presentation. But I want to point out that 36% of older Texans has a disability. And it could be that perhaps those disabilities were caused by a fall. And then also one of the things that we're looking at are the long-term services and supports are about 1/3 of Texas's Medicaid budget. And then also you can't get away from the impact of chronic disease in our lives, especially for those that are older Texans. 90% of older adults has a chronic disease. Next, please. So here's a few things we're just going to point out about falls. First of all, they're common. They are the leading cause of fatal injury and non-fatal trauma-related hospital admissions among older adults. And that stat of 1 in 4, I believe it's gone down to where it's 1 in 3, except in the case of Texas, where we have 1 in 4. So just some additional stats here for you. Falls are costly. Not only costly just financially, but also emotionally, mentally, and physically. It really does have a serious and significant impact on the quality of life. And costs are expected to reach about $101 billion a year by 2030. But what we do know is that falls are predictable. There are modifications that we can make within our own environment. And then also the personal responsibility to become more physically active. And we will be addressing that in all of our presentations. Next slide. So one of the things that we're going to be talking about, and one of the things that Jessica, Katherine, and I have been involved with for so many years, and Ashley too as well, is that we have been focused on evidence-based programming. And you're going to see this acronym, EBPs. And let me just lay it out what exactly evidence-based programming is. They are highly researched, community-based workshops. So they're programs that actually work within a community and usually are offered within a group setting. The research is shown to produce a positive result. The results then are peer reviewed by experts in the actual field. And one of the things too with EBPs is that the effects of an evidence-based program are significant and truly sustainable. So with that being said, I am now going to turn it over to Jessica. So next slide, and she will take it away and talk about one of our favorite evidence-based programs for falls prevention. Jessica.
Thanks, Cindy. I'm so happy to be here with y'all today. I am Jessica Martone. I am the new training and education coordinator for Travis County's Health and Human Services, and our group is called Coming of Age, that focuses on helping support older adults with volunteer opportunities and education opportunities. So what I am going to do is share some information with you about the A Matter of Balance program. And we are super excited that the Travis County Health and Human Services is able to offer the A Matter of Balance program to help our older adults better manage their own health conditions. All the programs that I'm going to talk to you about through Travis County are available at no cost to you. And so I'm going to share also how you can bring these programs to your community. If you have any questions about the material that I'm presenting, please feel free, reach out to me at the phone number that you see there and my email address, or just drop them in the chat and we'll answer them at the end of the presentation. Next slide. All right, this has a bunch of wonderful, scary statistics on here that I borrowed from the A Matter of Balance program. And so you can see here that, why are we talking about falls? Why are we talking about them now? Well, I can tell you that during COVID, my phone rang off the hook from many older adult communities. Their fall percentages were going through the roof. They've had more falls during COVID than they've ever had. And why is that? Because their older adults got their physical activity squashed down to nothing. They canceled those weekly trips to Target. They canceled those weekly outings to wherever they may be going, because we were trying to keep our older adults safe, especially early on in COVID when we had no idea how it was spreading. And so their physical activity got shrunk down to nothing. And we all know, you know, the physical therapists in my life tell you, move it or lose it, right? And so they were losing muscle mass, they were losing strength, and their balance then suffered tremendously from that. So what you can see here is that falls are the major cause of injury and death to older adults, and 20% of those falls cause a serious injury, and that can be life-altering for our older adults. So falls are the leading cause of injury and hospitalizations in the United States. And 1/3 to 1/2 of older adults acknowledge that they have a fear of falling. That fear of falling is associated with depression, decreased mobility and social activity, and increased frailty. Increased risk for falls come directly from that fear of falling, because then that results in that deconditioning of their muscle mass and their strength. Next slide. This is a really fun puzzle that I lifted, we'll say, borrowed from Public Health of Canada. I love to give this out in my classes because while it's funny, it really hits it home. It makes it a solid thing for older adults to see. And many of them will tell me, this is what my house looks like. I hope they're kidding. But if they're not, then it's a wake up call for them. So what we know is that 1/2 to 2/3 of falls happen in the home. Those older adults that think, oh, I'm afraid of falling, I'll just stay home, they're at more risk of falling at home than they are anywhere else. 75% of the falls that happen from routine activities, things like showering, things like going up and down the stairs, things that you do every day in your home, in your comfortable space, but that's what's causing those falls. So the other thing we know is that falls don't just happen. They're often a combination of things that come together that cause a fall. So falls are common, they are predictable, but they're largely preventable. And that's what A Matter of Balance is about. The other thing that I want to scream from the mountaintops is that falls are not a natural part of aging. And anybody that tells you that is terribly misinformed. And through the A Matter of Balance class, we talk about all of those causes of falls, and aging isn't one of them. Next slide. Well, this isn't exactly the most exciting slide, but it gives you the background of where A Matter of Balance came from. So what you can do to help yourself is to find a Matter of Balance class near you. If you need help finding a Matter of Balance class, reach out to me. I will help you. But what I can tell you is that the A Matter of Balance program was developed at Boston University in 1995. And now there are some of us that have been around a little bit before that, but most of y'all on the call are much younger than this program. So it's been followed for decades. Older adults that participate in this program understand the causes of falls. They increase their activity level. They do all the things that they can do to prevent a fall. So the program is based on the concept of cognitive restructuring. So this is a method of turning negative thoughts into positive thoughts. It's a way of changing the way we think about falls. We do a lot of how to identify barriers and obstacles when we engage in a new activity or going to a new place, and how to look at those things and identify what could be a problem and what you can do to go and do that activity safely. We then identify those strategies and we overcome them. We also, in this program, we plan realistic and feasible solutions so that you can experience success out there in the world and in your home, staying independent. The focus of the interventions is to change the misconceptions about falls. Again, that we've all fall because we're old. That is not true. So what we're going to do in this program is we're going to teach some skills that are going to promote self-confidence in your abilities. We are going to instill a belief that your efforts can make a difference in your chance of having a fall. And we're going to encourage positive responses in the face of difficulties. So those things that are in your way and stopping you from living life and enjoying things, and how make those happen again. Next slide. So the specific things in the actual workshop that we are going to look at are some of the ones that are listed here. The participants are going to learn that they can view falls as controllable. You can set goals to increase your activity. They don't have to be huge goals. It's a step at a time. If that's where you are, we'll meet you where you are. You can reduce your falls at home. We've got a lengthy checklist that you go through your home space by space, literally step by step, and what you can do to make home a safer place for you. And we do a small exercise portion of the workshop each week to help you with strength and balance. You're not going to sweat. It's not going to hurt, but it's going to be those key components that are going to keep you up and on your feet. Travis County is super excited to be offering the Matter of Balance class right now online while we are still trying to be safe at home and keep everybody, social distancing. Zoom's the best way to do that, right? So we are offering it online. And so we are super excited to have that opportunity. So while we can reduce our chance of having a fall and make our home safer, learning those exercises, we are also able to do that at home right now. There's a little difference between the online version of A Matter of Balance and the in-person, and that's basically to keep everybody safe at home. So we don't do the standing exercises that we would get the opportunity to do in person. And so hopefully our numbers come down and we're able to get back into person workshop soon and add those exercises back in. So the other big important part of A Matter of Balance is that if you're not having fun doing it, then you're not doing it right. So both our participants and our leaders having fun learning how to prevent falls is a big part of it. Next slide, Lauren. So what do we do during this long workshop? It's not that long, it goes by super fast. But what we do, it's a 9-week online workshop. We do a Zoom tutorial for anybody that's hesitant at all about getting online. We're gonna meet, we're gonna go through Zoom and how that works and make everybody comfortable using that. We cover the important topics that you see listed here, the group discussions, problem solving, skill building, assertiveness training, sharing practical solutions. What's a good solution for me may not be a good solution for you. and vice versa. So we talk about what's going to work for you. There's a couple videos. We do that little short exercise training, but we also develop action plans of how to increase your activity level and how to choose an exercise program. Lots of things to help keep you on the path. So there is tons more because it is a 9-week workshop. I can't go over all of them. I wish I could, but we're going to talk a little bit more about how the program works. Next slide, Lauren. So the Matter of Balance program limits the number of participants that are in the workshop to keep those small discussions comfortable for everyone so that everybody gets a chance to talk and contribute and be involved in those activities. So we are limited to 12 people online. We are going to talk about all those fantastic subjects and keep everybody involved. We meet once a week for 2 hours each week. Now there is an option to meet twice a week. I prefer the once a week. I think it gives people more space between the workshop to practice those exercises and do the homework. Homework doesn't get corrected or graded, but it is helpful for you to have that week to prepare for the next class and to learn about your own fall concerns each week. So like I said, we're going to meet for that 2 hours, and don't be concerned about 2 hours. We do take a break in the middle. Everybody gets up, they turn their camera off, they walk away, and then they come back. And if y'all are on Zoom as much as me, that break is a welcome thing to turn that camera off. So the other thing that we do is we train leaders to teach this workshop. What a wonderful, rewarding volunteer opportunity that is. So if you're interested in becoming a leader in the Matter of Balance program, all you would need to do is attend an 8-hour training session. That's usually broken up into 2 days, so a 4-hour session each day. And if you're interested in doing that, by all means, reach out to me. I can help you find a master trainer in your area, or we can figure out something to do over Zoom and make it happen as well. I'm really happy to help you support getting these programs running in your community. Next slide. So these are 2 classes that we have that just started this past week in Travis County. If you are a Travis County resident and you would like to participate, there is still time. We can add people the first and second week. So all you've got to do to join these classes is give me a call, shoot me an email. We'll have a few questions to get you registered, and I will send you the link and you can join those classes. This is the first time that these workshops are being offered by Travis County. And we have a great partnership with Age of Central Texas and the University of St. Augustine, bringing together those community partners to make these workshops happen. Number one, it makes it happen a whole lot easier when you've got more people helping support those programs. But it also brings together great minds to make these things happen and to sustain them long term. I have been working with the doctoral physical therapy students at St. Augustine for about 4 years now. And they do a fabulous job delivering these programs. And then also because Age of Central Texas has got such a great reputation of having so many workshops available to older adults in our community, it's just the perfect combination of things that Travis County Coming of Age can partner with these great community partners as well. Just a quick reminder, there is no cost to any of these programs, not to get trained to be a leader, and not if you want to attend, again, no cost whatsoever. Next slide. All right, so I hope that you all find these workshops as valuable as we do here at Travis County. If you would like to get registered for that class or the next set of coming classes in the next couple of months, all you got to do is reach out to me. There's my phone number and my email address on the screen. I would love to get you enrolled or get you trained to bring these workshops. If you had any questions, again, that chat box is down there. I am super happy to answer any questions, and I thank you all so much for your attention.
Thank you, Jessica. That was wonderful. And a Matter of Balance has been in the state of Texas for such a long time. So again, Jessica mentioned reaching out to her and or myself, or even our friends at Center for Population Health and Aging, and we can find out who is offering a matter of balance in your area. If you're not from Travis County, if you are in Travis County, though, please do reach out to Jessica. All right, so our next presenter is Katherine Tuck, and super excited for Katherine to join us from the United Way Area Agency on Aging of Tarrant County, and is the special grants manager for that, and has been providing a matter of balance as well as other programs within the Dallas-Fort Worth area. So Katherine, let's have you take it away.
Thank you, Cindy. So again, I'm extremely excited to be here today. So I'm with United Way of Tarrant County, and I work under the Area Agency of Aging of Tarrant County. And so it's kind of like an umbrella organization that houses the local area agency. All right, so we can go ahead and go to the next slide. So the whole reason we are here and everything that we've been talking about for the past week is all about fall prevention. And as we look at falls, there are really 4 primary fall risk factors that are involved, especially with older adults. We have medication management, home safety, physical mobility, and then environmental safety in the community. Now, medication management is really one of those big ones that people don't tend to think about. Especially among the older adults, individuals tend to be taking multiple types of medications, or they're on their vitamins. And so people don't always associate vitamins with being a type of medication or a drug. And so studies have shown that individuals who are taking more than one medication, especially if they're taking more than one medication a day, have an increased risk for falls, and that polypharmacy, or the use of 3 or more medications or drugs, is regarded as a really important risk factor in the cause for falls. And so we really want to prevent that from occurring, because I'll be talking about some other evidence-based programs that do have a medication component associated with them, specifically HomeMeds, here in a few minutes. But we can go ahead and go to the next slide. All right, so the Area Agency on Aging of Tarrant County over the last several years has been involved in numerous fall prevention grants. And then we also had a local grant that we received that, while it wasn't specifically designed for fall prevention, it involved many of the fall prevention programs that we've either heard about or I will be talking about here in a minute. So the 2 fall prevention grants that we received were from ACL, and it was the No Falls Partnership and the Falls Infrastructure Expansion and Integration Enhancement, which is kind of a mouthful. So we called them NFP, and then the 5 squared is what we refer to them as. Between these 2 falls, the areas that we covered included a total of 23 counties across the state of Texas. And so we were really excited to be able to build those partnerships and to bring individuals on board as we tried to address falls and reduce the occurrence of that among older adults. This 3rd grant that we received, so the Workforce Enhancement, Healthy Aging, and Independent Living, again, another mouthful of a grant, so we call it WeHail, was designed to really address lots of different things. It was a grant here that we targeted in Tarrant County, and we were really looking at low-income populations or individuals who were underserved. But it did involve a lot of the fall prevention programs, like like a matter of balance, enhanced fitness, bingo size. So a lot of those programs, and so we'll get into some of those as well. And we'll go to the next slide. So with those 3 grants, we've been able to develop many different partnerships around the community and across the state of Texas. So I just wanted to take a minute and to kind of mention some of these potential partnerships. If you're in your area and you're looking to build your program, maybe some of these you haven't thought to reach out to. Sometimes it takes a little bit of creativity to really design that partnership and identify who it is that you want to speak with. But you have your area agency on aging is always a wonderful resource to start with, to find out who is offering the program, and maybe if they've already partnered with them, and you can just piggyback or partner specifically with the area agency. You also have your aging and disability resource centers. Local churches are always wonderful sites, and a lot of the times you'll be able to bring the program to them. And if you're offering multiple programs, you can create like a revolving calendar, so that you're just offering unique things every quarter of the year or something. Congregate meal sites where there's already individuals there are wonderful opportunities for you to promote programs. So especially those virtual programs where maybe they might arrive for their meals and then they go home. If they have their technology, they might be able to join virtually, and that can help you fill those classes. Food banks are another wonderful opportunity to promote your programs. And then the fire department. The NCOA this past month has had some wonderful webinars about partnering with your local fire departments. And really, these are the individuals that, they're first on the scene often when a fall does occur, especially if it did result in an injury. And so they know those individuals that are at risk for falling or that have received or had multiple falls over the last, several months or so. And so they might be able to refer individuals to you as well. Hospital systems, they already have their patients. Setting up a referral base would be a wonderful opportunity to kind of create that sustainability of always having individuals coming into the classes. And one of my previous positions that I worked with, we were able to work with a local university who had clinics connected to them. And then they had partnerships with hospitals. And so we were able to create a physician referral system so that they could refer individuals for that specific grant that we were working on. But it's a great way to not only address specific needs among the older adult population and those patients, but to make sure that your doctors and different clinics around you know what's being offered and that there are resources out there for them. We also have long-term care communities, any type of residential facilities, your skilled nursing facilities, rehab centers, anything like that can all be kind of lumped together. These are in areas where you have set individuals where there's already population there. So if you're able just to bring the workshop to them, you have your participants. Here in Tarrant County, we've actually started a new initiative and we're working towards it. So it hasn't quite gotten the traction we're looking for yet because it's relatively new for this month as part of fall prevention awareness. But we're trying to target these types of facilities or communities to train either activity directors or to get revolving calendars or class calendars going for these facilities so that individuals are able to come in, even among the skilled nursing facilities or the rehab centers where individuals maybe are there for a short period of time and then they go home. We're trying to talk to individuals about offering virtual workshops as part of a post-discharge workshop so that the client or the patient doesn't need to come back to the rehab facility, but they're able to still connect to members of the facility and receive, a matter of balance workshops or any of these chronic disease programs that I'll mention here in a few minutes. And then Meals on Wheels is another wonderful site. We actually use Meals on Wheels to offer our HomeMeds program, and through them and other partnerships, Tarrant County is actually one of the largest distributors and participants in the Meals on Wheels program. And so these are wonderful opportunities. Public health departments, their focus is public health. I know right now many public health departments are transitioning their focus from education to focus more on COVID, but it's never too early to start those conversations in your area. You also have recreational centers. Again, you have a set population there. You can have a revolving calendar going, same for those senior centers, the retirement homes, and then your YMCAs as well. So these are all wonderful opportunities and potential partners that if you haven't already reached out to see what they are offering or if they are interested, great opportunity for you to start. All right, next slide, please. All right, so now I'm just going to talk about 3 specific evidence-based programs that we haven't mentioned yet. The first is Enhanced Fitness. So this program is one of those that has physical activity and exercise design and built into the program, which is always a great fit with older adults. They're always looking for that exercise when they sign up for classes. So each session is going to focus on 4 key areas. You have your low impact cardiovascular exercise, your dynamic and static balance work, strength training with weights, so this is a little bit different than, a matter of balance or bingo size where it actually has weights associated and integrated into the workshop. And then of course your stretching exercises, which is always important to make sure that your muscles don't cramp or that they're even prepared to do the exercise and warmed up in general. So all of these programs are targeting older adults or those that are aging or have disability, but there's a wide range of individuals that can participate. So you have everybody that might be, maybe they are a little bit more fit and so they're more able to use those weights, or even maybe some individuals that are just starting out. So maybe they're a little bit more frail or they need more or additional work to do. It can be done seated or standing. And the instructors are trained on how to really modify those exercises to fit the needs of that individual because everybody is different. We're all coming from different backgrounds, different abilities. We all know what our own limits are. So that's really key importance with any of these programs especially fall prevention programs that have exercise built in. Now, through the enhanced fitness program, really participants are able to show, or through the studies, they've shown that participants have a 35% improvement in their upper and lower body muscle strength and function. Anytime you get a group of individuals together, it's also going to help address any type of depression or social isolation among individuals, because they're able to socialize and they make new people. In some cases, they might even make those connections, showing that they're not the only ones that are dealing with those symptoms or those difficulties or challenges that they have. And so they're able to improve that when they participate in these programs. And then enhanced fitness has also been associated with a 26% reduced risk of falls that result in medical care. So Cindy shared several great statistics early on about falls and how 1 out of 4 individuals, result in a fall, but not only about 20% of those result in a serious injury. So if we're able to reduce those 20% of serious injuries from happening, that's always great. And then it also is associated with reducing healthcare costs for the individual as well. So this class, it is a 6-week-long class, so it is kind of a lengthy program, but it does have regular intervals after that 6 weeks, so they're able to continue to follow up and meet together. And as they go throughout the program, they are still having measurements that they're tracking in order to see how their upper and lower body strength and muscle use is improving and ongoing. All right, next slide. All right, HomeMeds. So this is a wonderful program. It is designed to address that pharmacology polypharmacy, wrong word, polypharmacy among older adults, because as older adults grow older, often they take more medications. And so individuals are able to meet with a licensed evidence-based medication management program or a case manager who's been designed to use the HomeMeds program. And it's really designed to identify, address, and resolve any medication problems that the system is detecting. So what happens is they can meet one-on-one, they enter all of the medications into an online database. The database will review it and flag any potential problems based on that information. And they will enter the medications. And so once the medication has been flagged, it goes off to a pharmacist who will determine whether or not changes need to be made or adaptations. And if that's the case, then they can follow up with their actual doctor for the individual to get that addressed. So it provides support for that older adult to really help them understand what their medications are for. And then it can identify any duplicate or medication related problems. And that duplication is really important, because especially if you have multiple doctors, they might prescribe a medication for the same problem, but it has 2 different names because one's a generic version. And for an individual, they might not realize that because we haven't been trained in what the different names are for different types of medications. And so this can be really important in identifying fall risk, because polypharmacy is going to increase the risk for dizziness, increase the risk for falls or even confusion. And all of those things can lead to a fall. So if we're able to reduce that duplication of medication, that will be a major factor in preventing those falls for the future. So the target audience, of course, is going to be individuals who have chronic conditions, older adults, but what's most important is that they are being treated by medication. So if they're not taking medications, then there's nothing to enter into the system. So this program might not be the best fit for them. But the whole goal is to improve that medication use overall. But it especially is wanting to improve the use of that cardiac medication and then decrease the therapeutic duplication that occurs. So only 1 home visit is needed. And then if any follow-up is needed because medications were flagged, then a pharmacist and the provider and the client's family will be able to work together to kind of get all of that done and resolved for that individual. But if there's no problems, then it's just that 1 home visit that is needed. All right, so next slide, please. All right, so the chronic disease self-management education suite of programs. I absolutely love these programs. These are probably the programs I am most experienced with, but they do include chronic disease, diabetes, and chronic pain self-management. So these programs are designed to provide support for individuals who have chronic conditions, but also their family members too. So that can be very beneficial to individuals. And it's really a self-management program. So we're teaching skills to empower that individual to take control of their lives and take control of their conditions that they have. So it's helping them to address those everyday activities like exercise, nutrition, and even symptom management that they're occurring, which is really important because, if individuals aren't exercising or they aren't being mobile or having that physical activity, then a lot of the times their muscles will atrophy and they become weaker, which is increasing their risk for falls. Nutrition also plays a major role in fall prevention. So inadequate nutrition or dehydration can again lead to that weakened muscles and that increased fatigue, which can result in dizziness and confusion and falls, all of the above. And so even though the diabetes self-management class is specific to individuals who have diabetes, it can still play a major role because if an individual isn't taking care of their diabetes and they're encountering low or high blood sugars, they could be at risk for or increased risk for falls. Something I absolutely love about the chronic pain class is that it includes, just like a matter of balance and enhanced fitness, it has specific exercises. I guess it's more similar to a matter of balance in the exercises that they're doing, because you're not going to get up and sweat like Jessica said. It's there to kind of use those small ligaments and smaller muscles we tend to forget about that really help us stay mobile and able to stay independent in the things that we're trying to do. So the target audience for these programs are really individuals who are 18 years and older. A lot of organizations might target older adults just because that's specifically what they're working with. So like the Area Agency on Aging, we tend to target older adults. But what's important about this is that it's individuals who are living with one or more conditions. And then sometimes we can kind of group in their family members as well. I always think about with the diabetes class, a lot of the times it's individuals that they might not be the ones that do the cooking for the class. And so their family members knowing how to cook for the individual to make a diabetic friendly meal can be really important as well. So with these programs, they try to target and improve health behavior, which include your exercise, your medication adherence and use, and even communication with family members and your healthcare professionals. So really helping them to become their advocate for their programs. They also reduce symptoms such as pain, fatigue, shortness of breath, depression, and again, there's that reduction in healthcare utilization. So these programs are done once a week for 6 weeks, and the sessions are 2.5 hours roughly. Sometimes they might end a little bit early, but they're always going to be that 2 to 2.5 hours. They should never go past that 2.5 hour mark though. And there's always a break halfway through the session to make sure the individuals are able to get up and move around. What's nice about this program is that it can be done virtually as well. There is also a toolkit, self-paced toolkit for individuals. So if they aren't able to participate in the full 6-week class, they can order their own materials and do it, have the same information done at their own pace, but they will miss out on that participation with a group that may help them to overcome different challenges or find that connection with other individuals. All right, next slide. All right, so this is just some additional resources in case you aren't aware of them. The National Council on Aging, Evidence-Based Leadership Council, and then the Administration for Community Living all have wonderful resources specifically about evidence-based programs, even potential partnerships. There's a lot of great information. If there's a program that you're interested in getting started with or you'd like to be trained in, the Evidence-Based Leadership Council can help you identify specific locations that might be offering the program in your area. But like Jessica said earlier, you can always reach out to us. You feel free to reach out to me and I can try to help get you connected to somebody in your area that might be offering the program. Thank you. I guess
Thank you, Katherine.
Cindy.
Yep. Thank you, Katherine. Next slide. All right. So I am just so appreciative of Katherine and Jessica joining me here today. And there's a couple of things that I want to address. They gave such a phenomenal overview of the different kind of programs that are available and the work that they are doing within the community as an area agency on aging or health and human services, or even as a community-based organization. So it kind of comes back to the 4 domains of prevention. And I have a saying, we've all heard the saying, an ounce of prevention is worth a pound of cure, right? But I added on to that where I said, no, an ounce of prevention and intervention is worth a pound of cure. So in the 4 domains of prevention, we have epidemiology, we have surveillance, and that's where we monitor and track trends. We're seeing that with the COVID pandemic that we have all been facing the last year and a half. And so we monitor and we track those trends, and we're able to get information from that. Then there's the environmental approach. It promotes health and healthy behaviors. That would be a lot of your public health and what we're focusing on with students from public health and leaders within the public health systems. And then also healthcare systems. They're a vital part of our health and well-being. We need to have those physicians. We need to have those hospitals so that we know that we will be taken care of if something were to happen. But the last domain is the one that I feel gets some of the least amount of attention, and that is connecting clinical settings to the community. Next slide, please, Lauren. And that's what we are focusing on at Unite Us. We are focusing on this incredible new model of care that is driven by the community. Next slide, please. In fact, if you'll take a look at this and click it again, Lauren, and you can see that, you know, health, it does equal us going to healthcare, but it also is so important to understand what is happening within the community. I have a saying that health happens at home, because most of the decisions that we make at home, whether it's to get that physical activity, whether to move those power cords out of the way, or to clean up that fall hazard, you know, whether it's maybe some water that spilled on the ground. Those are the simple day-to-day decisions that really have a vital impact on our health. And so with Unite Us, that's what we are focused on, is the healthcare and the social care, because it's within the community that we really need to connect people to services so that they can be the healthiest that they can within their own environment and within their own home. Next slide, please. So this is one of the things that really excites me about the Unite Us model, is that we have, of course, the coordination, that social care coordination through this incredible technology platform that allows different organizations from the community to actually talk with each other. And therefore, someone that would come in maybe to a food bank, they only have to tell their story one time. And maybe the food bank finds out, oh, you need some help also with utilities assistance, and you might need some benefits counseling. Well, let me connect you. And so through the technology platform, they are able to connect them to the community, and there is a response that is sent back within 24, 48 hours, and that person is able to get the help that they need and get those cases resolved. And we are also, with the incredible data that we are able to provide to our community based organizations, we are able to provide this incredible data that actually demonstrates to for the CBOs, to their funders, what the actual outcomes are of the referrals that they are making and the referrals that they are taking in as well. And then one of the things that really excites me that is being ready to roll out in 2022 is payments for the community-based organization impact. Is being piloted right now within the country. But this is where we learn more about, this is a true end-to-end solution, and it coordinates between all partners. And while we are working towards this vision of payments, and actually for those that are interested, we will be having a webinar on this very soon for Unite Us, and we're happy to send you that information. But as we coordinate that care, we use that data to tell your story, to demonstrate your outcomes. What we're going to be able to do is help you as a community-based organization secure more funding and more resources for your organization. And we want to be able to drive that conversation about really making an equitable service delivery model. So excited about this possibility. It's something that we've all been working on for the last decade in community-based organizations, where you get reimbursed for the actual impact that you are making. Next slide, please. All right. So one of the things that we are doing within our community, and Lauren and Ashley and the CPHA team, thank you so much for creating this incredible placemat. You can go to the next slide. This is a placemat. It's on 11 by 17 paper, and Unite Us has printed off these placemats, and we'll be able to print these off too over the next few months to deliver to your community-based organization so that you can raise the awareness about falls and how people can reduce that falls risk. I love the little thing on the bottom that the word scramble. And because we're going to go over some of those programs. We've already discussed several of them. So let's go ahead and go to the next slide. All right, so one of the communities that I've been blessed to work with, and I see Sharon's on the line, is the Healthy Aging Program with the Harris County Public Health Department. And they have a healthy aging program that is designed to promote the adaptation of healthy and balanced lifestyle among that older adult population throughout Harris County. And there are several things that they bring to the table: the chronic disease self-management program, fall prevention, and mental health and social service support. And next slide, please. So one of the things that, or some of the things that they are doing, because they saw that there was a need for the older adults in Harris County, and that the percentage was increasing with each decade. And they recognized that almost 17% of Harris County residents are expected to be 65 or older by 2030. We're all seeing that. We are an aging population. And among older adults, chronic disease and falls, they are the leading causes of death and disability. There is no way to get away from that. That is what we are experiencing, not just here in Texas, but also nationally. And so you can see that they offer those chronic disease self-management classes that Katherine described, some of our favorite programs because they are so impactful. And then also the fall prevention programs, they have a matter of balance, and they are working on being able to get that up and running virtually as well as in person when things are allowed to be able to be delivered in person again. One of the things that really excites me, though, also about the Harris County Public Health Department is that they actually have home assessments and modifications. They are able to identify fall risks inside and outside of home, and also be able to provide additional interventions in the home to be able to reduce falls risks within the own home. And then also the social services aspect, the case management, the emotional and mental support. When someone has a fall, it has been said over and over, what ends up happening is that it impacts them in several different ways: financially, physically, emotionally, and mentally. So being able to get that support is an incredible opportunity. And please note that all classes and assessments in Harris County through the Harris County Public Health Department are free of charge. Next slide, please, Lauren. And so if you want additional information about what's happening in Harris County, please reach out to Francisco Rodriguez. He is the program facilitator, and he is also on the line. And so he is able to assist you with any kind of help that you might need if you are having some challenges within Harris County. All right, next slide. So additional programs, I'll just briefly talk about these. There's Tai Chi for arthritis and falls prevention. Fun and amazing program. This one, what I want to point out too is that with all of these programs, virtual training is available. And so, Tai Chi, you can become virtually trained online and be able to offer this program, 8-week program. It meets 2 times a week for 1 hour. It's really amazing, the benefits of Tai Chi for older adults, especially as a physical activity program and as a program that prevents falls. One of the other programs that I personally love, and it's the Walk with Ease program. It was developed by the Arthritis Foundation. What's unique about this program is that you are able to offer it. It's 6 weeks long, but it can be offered in person or in a virtual format. It can also be a self-directed program. So I get excited about that. But with whatever way that you deliver this program, the participants are asked to walk 3 times a week for 10 to 30 minutes. And I know when I've led this program, the response has just been phenomenal, and people just find that it was exceptionally helpful for them to really get busy walking and to make a difference in their health and wellness. The last program is bingo size. Hey, what more do I need to say? Combining bingo with exercise, it's win, win, win. Okay. And so it's a 10-week program. It meets 2 times a week for about an hour. What is great about this program is that it is adaptable for all types of facilities. So it's not just for the active older adult retirement community. It can also be utilized within an assisted living facility too as well. And it's beneficial for all ranges of physical and mental abilities. Again, it's safe, it's fun, it's bingo, and it is another affordable program. Next slide, please. So Ashley has created this slide for us to see what are some of the different events that are happening across Texas. Of course, you can see Brookdale and Tarrant County where Katherine is. They are working on some things with Elder Care Support Network, also provided a lunch and learn for Encompass Health Rehab Hospital. They did that the other day. And then also the Brazos Valley Area Agency on Aging started a workshop with CHI St. Joseph's Mature Well. And then the Area Agency on Aging of East Texas, they also have started a Matter of Balance classes, and they also were able to secure a local proclamation. I want to say too that Jessica also started, I want to say about 2 other workshops here in Travis County. So we've got things that are happening. And if you have other events that are happening, please send those to us so that we can put that in and submit it for a national report on Falls Prevention Awareness Week. Next slide. All right, Ashley, I'll let you take it away.
Sure. Thank you, Cindy. So as Cindy mentioned, we did send out a survey to all of our partners across Texas this year to see what the great state of Texas was doing for Fall Prevention Week. And we will take those results and send them back to our national survey that NCOA sends out each year. So I don't know, this slide doesn't have the link on it. I must have missed that slide, but there's a link on the fallspreventiontexas.org website where you can take the survey. Plus, we'll probably send it out again to all of our partners after this week is over, just to see what events went on. So far, we have 23 responses from all different types of partners. They're listed there. And we were really excited to have different partners learning that they're doing things this week across the state. And then the next list is the types of things people were doing, mostly distributing falls prevention information or having webinars. But would love to collect this information. Like she said, we'll turn it into our the national survey. So please be on the lookout for that. And please visit our new site that we created this year for Falls Prevention Week that we hope to keep populating throughout this year with our webinars and our slides, and then carry on to next year. And that is fallspreventiontexas.org. I'll put that in the chat for everybody. So I think, I know we're really close to our 12 o'clock mark. I don't know if any of the attendees, this is in webinar view. So if you have a question, please type it in that panel and one of us can answer it for you quickly. But otherwise, like I said, I'm going to put this in the box for you. So www.fallspreventiontexas.org. Please visit our new site. We have our resources up there. All of our recordings from this week will be up there. And we hope to get some more responses on our survey.
I just want to thank everyone for being here today. So excited that we can spread the word about how we can prevent falls in Texas and then also beyond our own borders. So thank you again, coming together. You know, that is progress and working together. That's really how we're going to make that impact within the community. So please reach out to either one of us that you see as hosts or panelists. We are excited to be able to work with you within your community to help prevent falls. So with that being said, I don't see any questions, and have a lovely weekend.